around using this product and what you've seen with it and what you've experienced.
I sure will. Thanks for the introduction, and thanks for having me on. In following Dr. Spray and Dr. Kimberly, listening to their presentations on the sprays, it's really quite remarkable to listen about how we've been experiencing the sprays, especially the D3 spray, and even the B12 spray and the Q-Sleep spray, as it's been used here at the High Desert Heart Institute for our patients here, the benefit that we've seen for a multitude of our patients. We actually did a study on the D3 spray for our patients in the congestive heart failure clinic here, because a couple things that we do know that we've been able to find out over the years here. One of the things that Dr. Spray was sort of touching upon about people that aren't going out in the sun anymore, but we do also do a couple things to go from there. We do know that as people age, as they mature, as they age, they don't absorb as much from the sun, vitamin D3. If they have darker skin, okay, they don't absorb as much vitamin D from the sun. And what we're seeing now, what we've been seeing more and more, the more obese a person is, the less vitamin D will be absorbed into the blood stream. It remains more in the adipose tissue. And so those are three things that we do know, besides an area of where a person lives, but those three things that we do know that we're seeing in our patient population here in a heart failure clinic. But as you may be aware of, Jane, we're seeing a much more obese nation, much more obese world, but this is one of the things that's always been a challenging factor for us here. So what we had the opportunity to do was we had the opportunity to see exactly what Dr. Kimberly was talking about. How can we see a D3 used in a blood membrane barrier with a mucosal absorption have an effect in getting absorption on patients who may be having problems with a absorption system going on, whether they may be a diabetic patient population that we have in our clinic, whether they may be a patient who may have had maybe a gastric bypass or a lap band surgery and has some absorption problems going on. And we were able to see patients, take some of our patients who had I had one patient who had almost no circulating vitamin D. She had a vitamin D level of less than 4 nanograms per milliliter, which is really no circulating vitamin D. And in a 2-month time period with the spray, we were able to raise her vitamin D level to 80 nanograms per milliliter. One of the things that we have been seeing through the use of the vitamin D3 spray is that more patients that have been more of an obese patient population may need more vitamin D supplementation that is needed more than a person of a healthy age. And so as we've been able to, we've actually have in our lab here, we have a lab here at the High Desert Heart Institute, and we've actually incorporated the DiaSorin testing device that we can follow and monitor our patients' vitamin D levels to see how they are during that time period, how they were during the study that we did on the vitamin D sprays. And we really believe in the efficacy of the spray delivery system for these patients. And what we try to tell our patients here is, one, and not only our patients, but for patients, when I go out into the public and go across the nation and talk about vitamin D deficiency and a lot of things that Dr. Spray was talking about there, and what it really means to the health of our world, is that we have a situation here that we have probably one of the most inexpensive formulas here, inexpensive vitamins or hormones here that we can have an impact of overall health. We deal with in the cardiovascular health at the High Desert Heart Institute, but we do know that patients with congestive heart failure, patients with coronary artery disease, patients with hypertension, high blood pressure, these are all patients that are being affected in a positive manner, okay, by the vitamin D spray. And we've been following these patients now for 2 years, and we continue to follow these patients and have a pool of data that we are be able to utilize this with other institutions. So we sort of feel like we've been sort of have sort of insider knowledge on the benefits of the sprays and how they've been able to benefit not only healthy patients, but patients that have had other multiple disease problems and multiple disease processes going through. So Dr. Siva, myself, we are firm believers in the efficacy and the benefits of the spray system. Okay, the theory by the spray system, the mucosal absorption of it, in much more benefit, higher benefit than an oral gel cap and having to get into the large intestine, and that aspect of it there. I appreciate Dr. Kimberly also talking about the number of percentage of patients who have difficulty absorbing B12. We have a higher percentage of patients in our area down here also with pernicious anemia and B12 deficiency, and patients have coming in to get injections for B12. Now we have something here that they're able to get half of an injection in 8 sprays. And speaking of 8 sprays, one of the other beauties about this is that you have these sprays in a dosing form that can be utilized. And if you look at this with, when I found out about the Q96, how that can be utilized in the pediatric children population, this is something that I think is going to be a perfect fit. I mean, an unbelievable fit for the Q96. There's a new study, a new grant that just was developed for a professor down in Australia on the benefit to show the benefit of vitamin D deficiency in schizophrenia. So vitamin D deficiency in mental health, I think, you're going to see more and more on. Even though we're a cardiovascular facility, we're quite excited about being aligned on this aspect of it here. So with that, I'll turn it back over to you, Jane, and thanks for having us on the call.